Well, hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. For those who don't know me, my name is Dr. Arinola Dada, and I'm a rheumatologist. I am excited today to have my dear friend, Dr. Raina Gupta, who is a neurologist as well as a sleep specialist. I am going to let her tell us a little bit about herself, but I'm so excited to have her on the show. Welcome, Dr. Gupta.
Thank you for having me. It's a pleasure.
So, Dr. Gupta, tell us, why do you do what you do? What makes you passionate every morning for all the hard work that you do for our patients? Tell us a little bit about that.
Well, it's always wonderful to have a positive impact in people's lives and to feel them, make them feel heard, feel like they understand, what's happening in their body, in their sleep, in their health, and always be able to improve and optimize health and sleep. And I think for anyone, that's the goal for any physician. And I love seeing great outcomes. I love seeing patients say, I feel better, I sleep better, I'm healing better. And so that's really what makes it make sense.
I love the fact that not only are you an amazing physician, you're also a founder of Sleepology Health and Wellness in Chicago. How long has that practice been?
Yeah, thanks. So my practice has been here for about 2.5 years, and we are in Lincoln Park. We see patients through telehealth as well as in person. So very interesting sort of hybrid new age practice post pandemic and enjoying it a lot.
Yeah. Oh, fantastic. And I know that you've been doing this for 15 years.
Yeah. It's been a long time. I've worked in
Ex-
different arenas and I found that to be able to get patients in quickly, give them good service and good health, good outcomes, and get them back to their lives and their health. This is one very interesting way to deliver care. And so always looking for better ways for patients to engage and receive care, just as you do.
Yeah, but in addition to that, though, you also, have it, and you are so modest, so I'm going to call you out. You have been a leader in the field of sleep medicine. You've been working on research.
Yes.
Tell us a little bit
So
about that.
yeah, so I'm very interested in the developments of new treatments, new technologies, new understandings in our field, and how can we help people in a better way, in a faster way, in a more effective way. And so I do participate in research at Northwestern University in Chicago, and we look at outcomes of children and parents associated with sleep, and how can we improve their sleep from the caregiver standpoint, so the parent standpoint, as well as the child standpoint, and even understanding it as they age. So it's been a really interesting project and enjoying it, waiting for some great outcomes at the end.
That's really going to make an impact. I'm going to tell you, not just on the children's life, but on the parents' life for sure. So thank you for that, this important work that you do. Okay, so we are going to kind of talk about some issues that I think a lot of our patients are dealing with. And so, can you tell us a little bit about kind of the most common problems that you've encountered that patients are facing, and maybe some tips on how what they can do to improve their sleep?
Sure. Yeah. So there are four most common things that show up in anyone. So general population, any age, any gender, any other medical problems, or none. So number one, most common thing, and most of us have heard about this, but it's called obstructive sleep apnea. So I'll give you a quick, what is it? It's when the upper airway closes or relaxes when we sleep. And this can disturb our sleep or decrease the oxygen in the blood. This is so common in the general population. We think 10 to 30% of adults in the US have obstructive sleep apnea. And honestly, it is so easy to evaluate, it's so easy to treat. And it makes a huge difference in our brain health, in how we feel, how we sleep, treating fatigue, etc. So that's number one, most common thing that is worth knowing about and maybe looking into if you think there may be symptoms of that. The second category, most common thing, is restless leg syndrome. So, restless leg syndrome is something that's also very common in anyone, and it's discomfort in the legs that we know about. So we are aware of, yes, my legs feel weird, or I need to stretch, or I need to massage, or they're tingling, or something like that. In the evening, usually, and sort of recurring. So that's the second most common thing. Third most common thing is insomnia. Now, a lot of people have insomnia here and there. If there's an important event tomorrow or a big meeting or a big something, we all feel it sometimes. But for people that have insomnia that doesn't go away or doesn't get better, it's definitely something worth noting, worth looking for evaluation and treatment, and very common in the general population. And the fourth most common thing, I call this other. And this is something we should all be aware of or think about, which is what is impacting our sleep and what are we sensitive to? So, very common things. And all of us now can think about, is there anything in this category that impacts my sleep? Lights, sounds, temperature, pets, neighbors, stress, hormones, medications. So there's a lot of things that can impact our sleep. And a lot of this could be um, things that we just take for granted, we don't think about, we don't look into, we don't change, and we just deal with. And really we should not be accepting these anymore. We should look into it. We should put a little bit of energy, positive energy. I say we're looking at our sleep as a whole. And so I'll give you the tip of let's all prioritize our sleep a little bit. Let's put some positive energy into observing our sleep to see if there's any of these factors happening. We can ask our partners, our family members, whoever's around that's observing our friends when we go on a trip together. Hey, anything interesting? Am I talking? Am I turning? Am I snoring? These are very common. And so helping to just think about it, just put some positive energy into it. I'll give everybody that tip because if it's there and it's there forever and not treated or not even recognized, we can't really do anything about it. So just identify, and if it's something that needs to be evaluated, we can talk a little more about what does that look like or how what needs to be done for that. But put some observation and energy into your own sleep, and let's all do that tonight.
Wow, thank you. Thank you so much, Dr. Gupta. There is so much to unpack in those four things that you just mentioned. And I'll give you just a little bit of one of the things that I've noticed in our patients. So that number one tip, that sleep apnea. When I ask them, do you snore? Sometimes the husband is around, and if my patient is a woman, and the way she glares at him when she's like, don't you dare, don't you even dare, how I snore, you're gonna be in trouble, you know. But more important, more seriously though, once we get down that path of you need to get a sleep study, they usually don't want to do it because they don't want to use CPAP.
Yes.
How do you get around that for your patients? How do you get them in that right mindset to let's explore this, let's try to improve? Because for me, a lot of times when they come in, it's fatigue, and we're
Yeah.
asking that question. How do you get around it to get the patient to kind of move forward and, like you said, be open and have a positive mindset about it?
Yeah. I'm so glad that you asked that question because a lot of providers do not, a lot of physicians do not. They just sort of accept or gloss over sleep. So I think it's important to recognize that one, it's so common. It can be in the families. A lot of my patients say, "Oh, my parents have it, or my kid has it, or my uncle has it, or my whoever." It's so common that it's worth looking for. It's very easy to evaluate for. So even if we say I don't want CPAP or I'm not interested in that, we do home sleep testing. You can do the test at home. The test is easy. And then in terms of treatment options, there are four categories of treatment options. So CPAP is not the only option. We frequently work with other options. I present them all to patients because you should know what's available. And then you and your physician should decide together what's the right option for you. But the fact that there are other options is exciting and encouraging. And even if this is the right option for you, a CPAP, it's still a wonderful tool that it does its job. If we want to use it to fix the sleep apnea or resolve the sleep apnea, it does that. And so people can get used to it. It can change people's lives. It's amazing when we get to see improvement with just a simple tool. And so, yes, the wrapping the head around it and accepting some of these tools, like we use medication to treat or supplements to treat anything, our blood pressure, our arthritis, our, whatever. There are treatments for everything, including sleep apnea. CPAP is not the only one. So I'll give you that big yay, CPAP is not the only one, but it is very effective and it's something to consider for anybody. We have students, we
Yeah.
have college students who use it. We have lots of patients who don't use it and use other treatments. So it's worth having that
Yeah.
detailed discussion of what is best for me and what would work with my lifestyle. Because if it doesn't work for
Yeah.
you, there are other options, and it's worth having that
Other
conversation.
options.
Mhm.
Thank you. So I think the important takeaway for our patients is yes, just because your doctor is asking you about snoring, just because they're referring you for a sleep study, doesn't mean that CPAP is your only option. There are a lot of other options out there, but a knowledge once you have the information and you're informed, thank you, Dr. Gupta, then you can take the right action with your doctor. Then you mentioned restless legs. Can they make that diagnosis at the same time when they're having the sleep study?
Yeah, so restless leg syndrome does not require a sleep study to diagnose it. It's actually a clinical diagnosis. So there's four criteria. There's four things that somebody needs to have the diagnosis of restless leg. So very simple. The first one is discomfort in the legs, and that can doesn't really look like pain for most people. It's more of a it's annoying or it's cramping or something like that. So often it's not painful. And a lot of us overlook it because it's not painful. So number one, there's discomfort. Number two, there's an urge to move the legs or stretch or walk or massage or intervene. Number three, there's improvement with intervention. And number four, it happens more linked to our internal clock, our circadian rhythm. So it happens more at night or evening as opposed to the day. And it's usually in the legs. Sometimes people ask me this, could it be somewhere else? Yeah, it could be in the arms, it can be in the torso. I've seen it sort of everywhere, but very easy to evaluate and very easy to treat. So
Interesting.
those are the criteria. Go ahead.
They may need to really name that restless body syndrome.
Yeah, yeah.
Interesting.
Mhm.
Oh, that is so, yeah, I learned something today. That's good. That is very interesting. Yeah, and then, even with the restless leg, we always check people's iron levels.
Yes. Yes, I'm glad you do. We need to look at ferritin because iron panel and ferritin are easy to check in the blood, but these are potential genetic causes or contributing factors to restless leg syndrome. So I'm glad you're checking it. And we treat for anybody
Yeah.
that has low or low normal ferritin with iron, which is very simple. And it's very possible that this thing that's bothering you at night, and even if it's not every night, if we give a simple over-the-counter iron, it's possible it could improve or go away in a few weeks or months,
Yeah.
and we see that all the time. It's just identifying it is a factor, and a lot of times people don't even realize it. They say, "Oh, I toss and turn. It's hard to get comfortable." And then we go a little
Yes.
deeper, and we're like, "Why? Why is it hard to get comfortable? What's happening?"
Mm.
And so even recognizing it in your own self is I think challenging sometimes.
Mm. Yeah. So yeah, and this kind of delves into the third point that you made, which is it's hard to get comfortable. Don't just accept it because the next point you made was insomnia. And people have insomnia, and a lot of times people are like, in fact, I know people that are like, all I need is 4 hours of sleep, right? And they have insomnia, and they've just kind of worked their way into living that way, and they don't necessarily think it's a problem, and so they don't even bring it up with their physician
Yes.
as an issue. I lie in bed, I can't sleep, and then I just get up and I go do stuff, right? And so how do you start to tell your patients that, hey, this is not necessarily normal?
This is a great question. It's really important to evaluate for ourselves how our sleep is impacting our lives or lack of sleep. And so, some key factors for people to recognize are how do you feel in the morning when you wake up? Are you feeling foggy or groggy? Do you need your coffee before you're ready for the day? How do you feel during the day? How's the energy and concentration? Are there naps? Are there times when you're falling asleep driving or doing other tasks? Does it show up in your productivity? Does it show up in, in just not feeling well? And sometimes it's even deeper than we understand. It's in our healing, it's in our ability to be active or be more active. It's in our ability to make choices about what we eat and what time we eat and what foods we crave. So sleep goes a lot deeper. I think that it's important to just observe what's happening and don't accept the status quo. There are a lot of treatments for insomnia that are non-medication based, so natural, meaning timings, schedule, even things that a lot of us do, like come into bed using our phone, looking at our phone, watching videos. Like these are just behaviors, these are habits. And it's not good or bad, but if it's impacting your sleep or if you're noticing there are concerns about your sleep, then we can try changing the habits and we're happy to guide you with that. It's not one size fit for everyone, but simple changes in behavior, simple bedtime routine, simple shifts to our timings can make a huge difference in how much time we sleep, how well we sleep, and how we feel during the day. So it's worth recognizing it. It's worth observing and understanding your pattern, and then talking to your doctor or your provider about it.
Thank you. It is so worth, I'm just going to read, it's worth understanding, it's worth paying attention, because even tiny tweaks may really improve your quality of life. Thank you, Dr. Gupta. So, how can better sleep improve the patient's overall health? Because I think people start to get a little like, I came here for this. Why are you asking me about sleep, right? I came here because I'm tired. Came here because I have general body pain. Came here because somebody told me I had fibromyalgia. Why are you asking me about my sleep? I didn't come here for my sleep. So how can better sleep improve their overall health, would you say?
Yeah, and this is something we all can benefit from. So sleep is a pillar of our health. It is the way the body, if you think about it as a computer or a supercomputer, it's when all of the sort of other processes shut down and the brain is uh, cleaning the body. A lot of uptake of toxins and things like that happen during sleep. Some hormones are secreted during sleep, especially in children. Growth hormone is secreted, so it helps our body clean itself. Our memory is consolidated during sleep, even as adults. So short-term to long-term memories. So all of these processes are happening while we're asleep. The body's not just out of commission. And so it needs to shut down the other primary functions to be able to achieve these. And so improving our sleep has the ability to improve our immune function, improve our healing, improve our body's ability to fight infection, improve our body's ability to record memories, to transmit to long-term memory, improve our own restoration of our body when we're active, our muscles healing, our brain health. So it's so many things are happening during sleep that it's just important to optimize and improve it. And it's not just for now, this week, this age. It's when you fast forward 5 years and 10 years and 20 years. And this is one of the keys to healthy longevity. And the more we learn about the brain and the way the brain can heal from all kinds of things, including fibromyalgia, including anything, the more we can utilize or optimize sleep, which is mostly in our hands, to improve our health long term. And so I think that the impact is just now being slightly understood, but all of these processes are happening. I mean, honestly, in evolution, if this process is still here and taking up such a huge chunk of our day, then clearly it's important and clearly
That's
it's
true.
useful for
Yeah.
our body and our health.
Yeah.
And honestly, there's a lot of studies on sleep, improving sleep health, and how it can impact our healthy longevity. And so it's worth looking at. It's worth putting time and energy into.
Yeah, that's so important. And I think at this time, a lot of people are really looking at longevity. They're also trying to do things naturally and, and doing things that helps the brain, helps the rest of the body, probably may have the most bang for our buck if we really kind of focus on that. Thank you. One of the things that people, need to consider, what are the things that people need to consider when they're consulting a sleep specialist instead of just trying to manage some of these symptoms kind of on their own independently? Any thoughts on this?
Definitely. We need to first sort of prioritize and put some energy into observing and then ask our friends and colleagues, our partner, our family members. And then no harm in trying some tweaks on your own. No harm in saying, okay, let me change my bedtime, let me change my behaviors around sleep. But if there's still fatigue and daytime sleepiness, feeling that, not healing well, feeling of any any low productivity, low energy states, then it's worth going and speaking to your doctor about it and just addressing the concerns. If a sleep test is useful, it's just a data point. We need to collect information about what's happening. And that's how we make diagnoses and make targeted treatment. So if you just say, hey, I'm not sleeping great, like, okay, there's 1,000 things we can do for that. So we
Yeah,
need data points. That's what the sleep study's for. So it shouldn't be a scary thing. It shouldn't be overwhelming. It's not.
yeah,
And then, of course, talk to your doctor about what are the options for you, because
yeah,
then we need to go deeper into what's necessary, what's not necessary, and
yeah.
what's natural. And we always try to start with what's natural to get to improvements and benefits. And there's plenty of things that are natural that are worth trying and worth discussing.
Yeah. Question for you. When the sleep study, I'm just thinking back to my patients,
Yeah.
and there's a thought that the home sleep study may not be as good as the in clinic, in hospital sleep study. Do you have any thoughts about this?
Yeah, and this is a really good question because for a long time we only had the in lab or in hospital study, and
Yeah.
now technology has improved, and a lot of people are even using consumer grade wearables, watches, and rings, and I think that's great. But there's a difference in medical grade and consumer grade, and that's okay. But the home sleep studies, the data collection process has improved. There are different kinds of home sleep studies. Another tool that we use is sometimes we'll record more than one night. You're in your own home environment. So you're in your natural environment, which is better than me putting you in a hospital and putting
Yes.
a bunch of stuff on you.
Yeah.
And does that represent your true sleep or not?
True.
Probably not. Unlikely. Lots of people have trouble sleeping there or have to take something to force themselves to sleep there.
Sleep.
Just like when we travel and we go to hotels, some people don't
Yeah.
sleep well, some people do.
Yeah.
So home studies, the technology has improved. They are very useful. And if there's a reason why the home study didn't answer the question, we can always progress to the in-lab study, but it's really not required anymore. And we
Yeah.
don't often do them. We try to avoid them, as
Okay.
well as insurances try to avoid them too. Insurances are not a
Yeah.
fan of in-lab
Yeah.
studies, but neither are patients.
Okay.
So it's worth exploring the home
Okay.
study.
Okay. Fantastic. I think that would be reassuring because I think a lot of patients are like, well, if I'm doing it at home, insurance is insisting I do it at home. Maybe the test is not as good. So maybe a long time ago it wasn't, but now technology has really improved it so that people have that. And then, of course, your advice, which is take that step to make sure that we understand why and maybe get some data points. And then maybe we're halfway to finding solutions because you've taken that step, you've done the sleep study. It's not scary to do a sleep study. And then I think you and your doctor will be able to walk forward so that, we can basically help you have a better quality of life. I like that longevity. I think it speaks to a lot of us over 50.
Yes, of course. And this is such a huge area of interest. And like my whole world is brain and sleep. And so, of course, my goal is how do we have people healthier, longer? And sleep is such a huge component of that. So
Yeah.
it's worth talking about. It's worth spreading the word.
Yeah.
And of course, hormones, menopause, all of this, all of these life changes in
Yeah.
any stage of life impact our sleep, and it's
Definitely.
important.
Yeah.
Yeah.
So, can you share a story, Dr. Gupta, about a patient who's had an amazing outcome after the benefit of being in your care?
Yes, I just saw a young, healthy woman yesterday. I saw her back after her diagnosis and treatment. She came to me saying, I'm not sleeping enough and I feel terrible and I don't know what to do. And so I said, okay, let's look a little deeper. And she didn't have any overt symptoms. It was more fatigue, it was more just not feeling great and not feeling like herself. And so we did sleep testing. We found that she had sleep apnea and she was only sleeping about 4 hours a night, really not enough um, for anybody, for most people.
Yeah.
But we did sleep
Far as not
testing.
enough.
Yeah, we treated her, and I saw her back yesterday, and she said, "This is amazing. I feel like a new person. This has changed my life." And I looked at how long she's sleeping. She's sleeping 7 to 8 hours now with treatment for sleep apnea. And she
Mm.
feels great. She started a new job. She
Love
has
it.
better productivity. She's enjoying time with her friends and family. Like
Yeah.
just her whole life changed. And this is a
Yeah.
very small,
Yeah.
um, easy to treat, easy to diagnose, easy to manage
Yeah.
sleep issue. And I was so happy to hear that. And I love those stories of you
Yeah.
changed my life, or this thing changed my life,
Yeah.
this diagnosis changed my
Yeah.
life. And she was young. She's in her 20s.
Yeah. Good
She
for
has,
her.
if you fast forward 5, 10 years of her
Yeah.
feeling terrible,
Yeah.
what would that cause, and
Yeah.
what would that impact? So
Yeah.
these stories, I see these every day. And, if
Yeah.
this is something concerning for your patients or for you, whoever's listening, I
Yeah.
would say go check it out. I would
Yeah.
urge you to do that.
Well, that is such an impactful story. And when you mention productivity, I think it's important for us to kind of take a step and understand that productivity also may mean that she's able to do more things in a shorter period of time and go spend more time with her family. Right,
Yes.
because her brain is now working at capacity, not because it's fatigued, because she had didn't have enough oxygen getting into the brain because she had sleep apnea. So thank you. And that's a 20-something-year-old. Yeah. Can you imagine that 10, 15, 20 years untreated and the impact that would be for everything, her career, her children, her lifestyle, her family. So that is actually a very impactful story. Thank you so much for sharing that. And my favorite question is, if you had a superpower that would help your patients, what would it be? And how would it make a difference to their care?
I would say we all need to prioritize sleep. This phenomenon showed up like nap rooms at some point in some
I
companies.
remember
Yeah.
that.
And nobody believed that, oh, we should nap or we should, I think it was NASA, and that we should allow people to sleep. Like really in our culture, not sleeping is a badge of honor. And that doesn't make any sense because there's so much to show that sleeping better or even naps increases our productivity, increases our health, increases our whatever. So I think prioritizing sleep or putting like a big star, this is important, would be the most important thing. And even for ourselves, it's not better to sleep less. It's not better to be tired. It's not better to not allow your body the rest it needs. And so I think that I urge all of us to think about it, put some time and energy into it, even record thing, even make a note for a week. How about let's do a challenge, a 1 week challenge. Write down what's happening, how you feel, pay attention the next day, and say, oh, well, I like it when I have caffeine, when I stop caffeine at lunchtime. I sleep better, I feel better. Or, very simple things like, oh, when I exercise, I sleep deeper. I'm going to try to do that, even 10 minutes of walking or whatever your favorite thing is. So I think just paying attention, prioritizing sleep. Naps are okay. People ask me this every day. Short naps early in the day are okay if it helps you, if it recharges you. We should all have nap rooms, in our companies and our offices. So I think creating the awareness around sleep is what I would want.
Wow, thank you. So not sleeping fewer hours is not a badge of honor. Okay. And and understanding that it's okay to take a nap. I will tell you, some of my patients feel a little like, what do you mean? I don't take naps. It's like,
Yeah.
yeah. you
Okay.
know,
Naps are okay.
Naps are
Yeah.
okay. Naps are okay. It's not a badge of honor to tell us how you're able to function without sleep. That's not a badge of honor. Thank you. That is so, so important for us to remember, especially it's such a go, go, go world. We're all high achievers and really want to take a minute to make sure that, hey, you're thinking long term. You're thinking long term and longevity. Oh, this has been amazing, Dr. Gupta. Thank you so much. So, tell us, for anyone who's in the Chicago area, how do they find you?
So my practice is called Sleepology Health and Wellness. We are in Lincoln Park. We see patients in person and virtual. We're insurance based and we see all adults with any sleep concerns. Our website is sleepologydoc.com. So I'll spell it because we spell sleepology in a fun way. So sleep, SLEEPOLOGIEDOC.com. We're also on Facebook. But look us up. You can find us. We'd love to see you or your friends or colleagues anytime.
Oh, thank you so much, Dr. Gupta. Thank you, everyone, for listening. Do like this video, share it with anyone that you love or that you feel is maybe benefit from understanding a little more about their sleep, which I think is everybody. And subscribe to our channel. I'm going to have Dr. Gupta's information attached to the bottom of this video. So if you're in the greater Seattle area, greater Chicago area, and you're flying through, do stop by and see Dr. Gupta and her team, and you're going to feel much better from your brain resting, from making sure she'll make sure that you're getting adequate, good quality sleep. Thank you, everybody, for listening, and we'll see you next time. Bye.